Hello and welcome to the Multicultural Media Online Conference hosted by the Ministry of Health, Multicultural Health Communication Service, and Multicultural New South Wales. I'm Jesusa Helaratne, Deputy Director of the Multicultural Health Communication Service, and I am your moderator for this session. Thank you for joining us today. We're really excited because we have two special guests to talk about a daily thing we do all the time, brushing our teeth or taking care of our oral health. So we have today joining us Dr. Angela Masoe, Manager, Prevention and Oral Health Promotion Center for the Oral Health Strategy of the New South Wales Ministry of Health. Hi, Angela.
Hello.
Nice to see you. And we also have Associate Professor Shilpi Ajwani. She is the head of the Oral Health Promotion and Oral Health Research at the Sydney Dental Hospital. Hello, Shilpi. Thank you for joining us.
Lovely to be here.
Thank you so much. We have a lot of questions that you may be asking yourselves, but we'll have that later on. But before we start, we'd like to begin by acknowledging the traditional owners of the land from which we are all meeting from today. We pay respects to elders past, present, and emerging, and also pay respects to our Aboriginal colleagues and communities that may be joining us today. We also pay respects to leaders of community, members of multicultural communities and refugee communities who we represent, who are joining this session today. And we are joining from the land of the Camaragal people of the Eora Nation. Now, we'd like to request if you can please keep your microphones on mute, but have those questions on hand and put them on the chat, because this is going to be a special conversation, because we all know we brush our teeth. We all know we try to take care of our oral health. But what is the proper way and strategies in keeping our teeth and mouth clean? Now, we'll start with Professor Shilpi. This is, next week is World Oral Health Day, and that's on Wednesday, the 20th of March. And we want to take this opportunity to speak to you about the issue of oral health and preventative care for our diverse, culturally and linguistically diverse communities, for older people, children, and as well as refugee and asylum seekers, and where you can go and what services you can find. Now, Shilpi, the World Health Organization identifies oral health as a key indicator of oral health, overall health, well-being, and quality of life. I'd like to start. What is proper oral health? What do you do? Because the mouth is really important. It's seen, it's visual. How do you take care of it?
So it's good to start by understanding what mouth is and what oral health is. So oral health, many people just associate with teeth and gums and brushing, but oral health is what we consider an important part of the body, because we believe that oral health is actually a mirror to the body. So if your mouth and oral health is not very happy, your body is definitely not very happy. And for us, oral health includes health of your lips, your cheeks, your tongue, your teeth, obviously teeth and gums, but also the roof of your mouth, your palate, all the way to your airway. All that is oral health. And if there is an infection in any of those areas, including skin cancer on your lip to oral and pharyngeal cancer of the pharynx, it all comprises of oral health. And therefore, looking after your entire mouth and oral health is very important.
And that's important for all communities.
Absolutely. Yes, I think it does not matter whether you are living in urban area, a rural area, you're coming from a multicultural community, if you're from Aboriginal background, it is very important to make sure that you give importance to oral health and develop routine good oral habits to have a good oral health across your lifespan. There is never a good or a bad time to look after your mouth.
No, we're using our mouths today to communicate. And that's important, right? Shilpi, in terms of working with communities, and you're a dentist, you're head of the dental clinic, how important is it to promote that? And how do you motivate people?
Yeah, I think that is very challenging. And that's why we utilize platforms like World Oral Health Day and this platform, speaking to you, to bring awareness about oral health for people to take a moment and think about oral health, because life is busy. There are priorities. Everybody has, they're living in a fast-paced life, and families and kids, and priorities do take over. But it is really important to make sure that you think about your oral health, your family's oral health, good oral health habits, and how it can not only improve the health of your teeth, but also improve your quality of life. Having a beautiful smile is a very powerful thing.
That's right. And
Yeah.
you have great smiles, by the way. I'd just like to ask this question from the participants who are joining us online. Please jot down your questions, because we have experts in dental and oral health care, and it'll be wonderful to see if your habits, what you're doing is correct. So Angela, and you're in oral health. It's such an important role that you take on to make sure that people are knowing how to prepare strategies for communities to make sure that oral health is a priority. How do you do that within New South Wales Health?
I think it's very important to work with our partners, like, very important with our branch partners here at the ministry, like working with the Centre for Population Health with their healthy eating, active living programs, working with health and social policy programs with their first 2,000 days. Now that we've got a new strategy of we want to go upstream, for promote when you're planning a baby, planning a family, then, all those people that are there to support parents to become parents, and right throughout our first 2,000 days, so all those programs support us get the message out and work together to actually ensure that oral health is part of the messaging and the health promotion strategies out there, working with, our partners in health protection to make sure that our water's fluoridated and safe, etc. So all these strategies we work in partnership with others across the ministry, and then with our communities, like, we engage with our stakeholders, key stakeholders all the way in our local health districts, with our Aboriginal community control services, and the community having that engagement. So it's working in partnership across the spectrum. Yeah.
Yes, and also, but we what do we put in our mouths, and what are the prevention strategies? Is it how healthy should we keep it, and what do we do to eat and drink?
So it's so important, like, to work with culture, with different multicultures, because everyone, like, if we have healthy meals with our parents, in the home environment, like we've got our, important strategies for healthy meals, healthy lunches, etc. And then, working with those communities, ensuring that preparation of meals is right, and drinking water is one thing as well,
I think
ensuring.
what is very important is the importance of traditional meals.
Yeah.
I think multicultural communities have that advantage. The traditional meals have always been something that's high in fiber, it's good nutrition, it doesn't have high sugars. It's good for your general well-being and excellent for teeth. And promoting your own cultural food is so important. I think we are going back to basics, where we are saying to not go for the short, easy snack bars which are available at the supermarket. Stick to traditional food and encourage moms should be encouraging children to have that healthy habit of eating home food.
Okay, the questions are coming in, and it's great. So we have Carolyn Murray, who's asking, going to the dentist can be expensive. What is available for those who can't afford it? So I'll go to you, Angela.
Yeah. So for all our children here in New South Wales, we're very privileged that all children 0 to 17 have free dental care in New South Wales. And also for families that are on Family Tax A, we've got the Child Dental Benefit schedule as well, that they can access public health and private practice. So, and then for our eligible population, as long as they've got a Medicare card and a healthcare card, senior card, then those are the patients that we, people that we really need to see as well. But prevention, overarching, our preventive strategies for our population, I think that's where we want to head. Like, don't have to, it can be, we can prevent dental disease, with using some simple strategies at home. So that the cost always comes up, but
It's that habit, right?
Getting prevention.
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 Now, someone's asking, Professor Shilpi, tongue cleaning is not talked about enough. What are your thoughts on incorporating tongue cleaning as part of your teeth or mouth cleaning routine?
I 100% agree. As I said, tongue is part of the mouth. Bacteria don't decide where they can hide. They don't just choose teeth and gums. If a tongue is not clean, That means there is a lot of bacteria sitting on your tongue. So regular tongue cleaning is an excellent way to keep your mouth clean. It's one of the main causes for aspiration pneumonia in older people because they tend to take a lot of medications. Their mouth is dry. There's a lot of bacteria in the mouth, bugs in the mouth, which don't get washed with saliva, and a lot of it harbor in mouth, teeth, and tongue. And if they happen to cough and inhale those bacteria, that's how you get lung issues and conditions. So tongue cleaning is absolutely an important aspect of oral hygiene.
Well, thank you for that. We have a question for Biljana. Are there any dentists that bulk bill for working people?
It's a tricky one.
So most of the dental treatments in the private practice are not covered under Medicare. It is privately funded. People who have a healthcare card or a pension care card, one of the concession cards along with a Medicare card, are eligible for accessing dental treatment in public dental clinics, and it is in New South Wales absolutely free. So if there is an urgent need that you have, if you're in a severe tooth pain, there is a universal 1-800 number patients can call to access urgent and emergency care in public sector if they're eligible. For children, as Angela mentioned, any child under the age of 18, as long as they have a Medicare card, they can access free dental care regardless of their parents' income.
Okay, well, that's a good information. That's really good information. We have a question again from Caroline, who said her question, how does vaping and smoking affect your oral health? And a lot of the messaging we are promoting is for young people who are accessing vaping and other tobacco products.
Absolutely. I'll let Angela talk about the strategies of smoking, but as a clinician, I think smoking has a very direct impact on oral health because the first place the smoke goes is the mouth. So it just doesn't stay there and disappear. It gets absorbed in the tissues. It has impact. Nicotine has a huge impact on your blood flow, blood supply, health of the teeth and gums. It's one of the main risk factors for gum disease. People, those who are smokers, tend to lose their teeth because the gum disease progresses very fast if you're a smoker. And vaping is fairly new. There's still emerging evidence about the impact of vaping, but the side effects and the contents that vaping has is far more dangerous than smoking. So I think there is more evidence to come, but the initial evidence shows that vaping is probably 10 times worse than smoking.
So it not only affects your lungs and other organs, but the mouth.
It has a direct first impact. It's a risk factor for cancer. It's a risk factor for gum disease. It is a risk factor for a lot of cardiovascular and general health diseases. So it is one of the leading causes of morbidity in population. And some of the communities have chewing tobacco, which is very prominent, and that tends to that leads to oral cancer of the mucosa, and it's a very silent disease because it doesn't cause pain, and therefore dental checks are so important because dentists pick up these white lesions, something which is white and patchy, and patient says, "I don't feel anything," but that is something when caught early can be a huge life-changing event for that patient. So regular checks is so important, even if you don't have pain.
Oh, thank you, Dr. Shilpi. Dr. Angela, in terms of the strategy, in terms of communicating this to general population and multicultural communities.
We're working in partnership with our, the Centre for Population Health campaigns, the Tobacco and Vaping campaign, as well as Cancer Institute, getting the messages out, raising the awareness wherever we can be, in our dental clinics. We're promoting, brief intervention at the chair side when they come through. We check, are they a smoker or a vapor, and then we have intensive brief intervention at the chair side, and then a referral pathway to quit lying for coaching. And I think that's very important. And these campaigns out there we're promoting, and I think for the multicultural groups as well, there's translation happening as well. So that is really good. It's raising the awareness as much as we can wherever we can be, the work that's done out in the community and across the state. Yeah, it's promoting that. Don't even start smoking, don't even start to vape, you know, which is really good. And looking at our adolescents group, you know, like steering them into the right direction is very important, and communicating. Like some of the parents are coming through and say, I've got a 14-year-old, you know, what do I do? And then you just help them, like, you know, help them get the help that they need to receive from the health professionals, and that referral pathway for, you know, intensive coaching has to happen for them as well.
And oral health, you know, there's poor health literacy in oral health, and what can we get? What information is out there for the community? So
we're actually creating more information and working with the multicultural community, you know, services to actually translate some of our, you know, our assets for how to brush. We've just finished that one, how to brush. And from your last session, Jess, you know, one of the key things that was raised was access to dental care. And so we've gone, you know, we've partnered with your team to actually translate our access brochure, because that's so important, and then communicate that through to all our stakeholders at various levels, and encourage more community engagement. It's so important. Where do I go? And then, you know, if it's newly arrived migrants, where do they go? So it's working right across the LHDs as well to, you know, reach the populations that really need extra support.
And there are those translated resources are available on the New South Wales Multicultural Health Communications Service website. So look that up, and we'll add that to the chat. But also, I guess when the last session that we had, and we mentioned, I learned how to brush my teeth by spitting, not rinsing, right? That's how it was. And that's what you mean about how to brush your teeth properly.
Correct. There's always that question, why do I brush? So just remember that there's gazillion of bacteria in our mouths, and they love sugar. You know, there's specific bacteria like that actually love sugar and turn it into acid. So why are we, you know, pushing this brushing teeth? It's because we need to disrupt the plaque that grows, that is made by this bacteria. So, you know, brushing is so important. Brush along the gum line is so important. And as I said earlier on, brush, you know, every single teeth in the mouth, as well as, you know, making sure that we can get to floss. Spit all the toothpaste out and don't rinse. Leave it for 30 minutes. So, because we want to take the, you know, the reap the benefit of the fluoride in the toothpaste. So
now there was a question here before there's a question by Lydia. Many people are not aware of using floss for cleaning teeth. How can we improve this message? I guess that's just what you were saying.
Yes, I think it is important to know what the role of floss is. So flossing is really helpful, as Angela said, disrupting the plaque or breaking or agitating the bugs in between the teeth. So your brush tends to reach areas that are easily visible. But when you have really tight contacts between the teeth, that's area that the brush doesn't reach. So knowing why it is important to floss, especially if you have crooked teeth, a lot of crowded teeth, those are patients or people where dentists would strongly recommend how to use a floss. There are nowadays different ways of flossing. You know, you have the traditional hand flossing, which a lot of people find a bit difficult to hold correctly and push. They tend to push through the gums. It's very important to move your floss front and back gently during the tight spot rather than jamming. So once you learn that technique of going front and back to slide it, because you're not trying to hit your gums, you're trying to break the plaque. So you've got to agitate, make them uncomfortable, get them out. So, and there are flossets, there are ready-made tools which have got a floss attached to them, so they can be used as a tool. And if you're wearing braces, then the orthodontist gives you a special type of floss as well, because keeping your teeth clean when you're having braces is so important, because you can end up with really well-aligned, beautiful teeth, but a lot of cavities because the bugs have got new places to hide, which are your braces. So your oral hygiene should be much more strenuous and strict and really good if you wear braces.
Thank you so much. Now, if you have any questions, please put them on the chat. And we have information on vaping for young people and teachers and parents from Carolyn Murray's put the link there on tobacco and vaping. So these are really important resources. And resources are coming from the Multicultural Health Communication Service with links. Colleagues are putting them there. So take note of them. And the theme for World Oral Health is happy mouth, happy body, happy life, and beautiful smiles, I guess. Can you tell us a bit about how oral health and general well-being is connected? I mean, if you happy with your teeth, you smile.
Yes. So it has a relationship, as you said. If you have a good smile, you feel so much better. Your quality of life is good. You're able to eat the food you like and have nutritious food. You don't tend to avoid food. Once you start missing teeth, start wearing dentures, you tend to compromise on the kind of food you eat, and that affects your health, overall health, because your nutrition gets impacted. But also, as we have spoken so far, if you have an infection in the mouth, it doesn't just affect the mouth. The body is, if it's fighting the infection in your mouth, it is doing something that is damaging the rest of your body as well in the process. And that's how we have a very well documented two-way relationship between gum disease and diabetes. So if your gum disease is advanced, then the doctor will have really tough time bringing your diabetes under control.
Wow.
And vice versa. So if you have diabetes, dentists have a hard time bringing gum disease under control because there is this two-way relationship. There is emerging evidence about gum disease and pregnancy outcomes. So the health of the baby and your mom's health is really important, and and gum disease can impact that. The gum disease is known as a risk factor for a lot of cardiometabolic diseases, like the cardiac disease, stroke, arthritis, and other inflammatory diseases. So the interrelationship between oral health and systemic health, more and more evidence is coming. So by following simple steps, keeping your mouth healthy, gums clean and healthy, you're doing great things for your body without even realizing it.
Well, thank you, Dr. Shilpi and Dr. Angela. Those are the main things, like diabetes. The food you eat comes in through your mouth. But what are the other main diseases that's associated with oral health?
I think we've already mentioned dental decay, is a key culprit because, if you've got dental decay, this is why we need to control dental decay, early, our programs for early childhood. Because if you've got dental decay as a child, then it looks, definitely you'll suffer dental decay as an adult if we don't put our preventive strategies in place. So that if we capture the disease, control it by putting in, toothbrushing, supporting the parents at home. I love what Shilpi said about the traditional food, healthy food, along the lifespan. So early childhood, I'd love to see all the children, going to school with no decay. So we need to support the parents where they are, because it's the home environment. If they're, if a child can actually get to school with no decay, then we've set them for life, and then go through primary school, their well-being is set. So yeah, I think got a long journey with trying to control dental decay. And there are methods that we can, if they come to the dentist with, a little bit of decay, we can control it, then they can continue on school. The percentage of people with no decay is increasing, but a small portion of the population still high decay. So we need to work with them a little bit more to get them on track. So on track. And right throughout, we want them to leave high school with perfect teeth, healthy mouths, and so on and so on. And,
Now, there's a question here. Is mouthwash necessary, or is brushing, flossing sufficient? And I remember this from the last session, that a fluoride is really, water in New South Wales has good fluoride. So that's really good to note as well. But is mouthwash necessary?
So the mouthwash, there are two types of mouthwashes. One is one which has extra amount of fluoride. So as you said, by good brushing and using drinking tap water, you provide a lot of fluoride regularly to your teeth. But there are certain groups of patients who have really high rates of decay, and sometimes this added load of fluoride is really helpful. So in those cases, the dentist or the specialist does prescribe
Mm.
a fluoride mouthwash. But the most common mouthwashes you get in the supermarkets, they are more targeting gum disease. And again, if you are able to get rid of that bacteria by brushing and flossing, you really don't need a mouthwash to do any additional work.
It'll
Yeah,
save you in cost.
Yes, but what people tend to do is use mouthwash as a replacement for
Oh, yeah,
brushing because
yeah.
it gives you a nice fresh flavor in your mouth for a short amount of time. But as we all say in dentistry, it's like washing a kitchen sink with a soapy water without scrubbing. Just putting a soapy water on a kitchen sink is not going to clean it. You got to scrub it. So
you got to scrub it.
you
So
got
that-
to, that is more important than just using something on it.
So what is a daily routine I should be doing for everyone out there? For example, you wake up in the morning, you brush your teeth, or what do you do? What's your recommendation as the oral health specialists?
Yes, I think what we recommend is, as you said, you wake up in the morning, you rinse your mouth, you get ready. If you're a working person or going to school, you have your breakfast, then go and brush your teeth. And make sure you don't eat or drink for at least 30 minutes after that. So it allows the softened teeth to harden again. Because every time you eat, your teeth become soft. There is what we call demineralization. And what fluoride does is hardens the teeth. Saliva, what does saliva do? It hardens the teeth. So give your mouth time to heal itself. And then you can go about doing your daily work and try avoiding snacking, frequent snacking, because as I said, every time you eat, you are trying to, the tooth gets attacked by bacteria and acid. So limit the number of times you snack. Keep it to 3 main meals and 2 snacks. Make sure you give your mouth adequate time to rest in between. Drink plenty of water. Hydration is so good. It flushes away all the bacteria. It hydrates you, and it's good for your skin, makes you look healthy and happy.
Well, it makes you happy, but here's a question.
Tips for avoiding bad breath, because that is important. You might not be able to smile well, or if you have bad breath. So how can you avoid it?
First up is good oral hygiene, right? But then besides good oral hygiene, there might be systemic, other general diseases that, we need to identify as well. So your GP will help that, because it's not about just the oral health, because as I said earlier on, we need to reduce the burden of bacteria in our mouth, the number of bacteria, and then that decreases the, acid producing and all the bacteria, the aroma coming out as well. So good oral hygiene and checking with the GP if there's any other general health issues that we need to address as well. Yeah.
And what communities or groups that we should be giving more information or focus on, and why oral health is even more important to these groups?
Priority population. New South Wales Health does focus on certain population that they feel require a bit more information and interaction and intervention. So we have people living in rural and remote areas, those who live in non-fluoridated areas, because there's still parts of New South Wales that are not fluoridated, and there is a higher risk of dental disease there. Obviously, pregnancy, pregnant women, making sure that mom and family have a good start. Also making sure the refugee and asylum seeker population, newly arrived migrants, they have not yet established roots in our community, so they need a bit more information and assistance. And people with disability. I think where there's still information that they require, because access is a barrier. Not just where to go, but how to reach is also an additional barrier for many of them. So having information on Australian Dental Association website, for example, which are wheelchair friendly practices, they help people navigate better and access services. So make use of the resources that are out there, and ministry has a lot of information and strategies as well for the priority population.
Thank you, Dr. Shilpi, but also a question.
Sorry, and also the carers, so important, the elderly, those, in mental, the residential aged care facilities. We want to ensure that they get the right information to support all those residents, that are, in different facilities. Yeah.
There's a question here from Sylvia. What's the link between oral health and mental health?
Yeah, well, so medication, and I just want to put this on the table as well. Medication, because of those that are on, medication to help them, it actually, as Shilpi said, the dry mouth, impact of the dry mouth, and also because of their demeanor, then they're not brushing, they don't feel good. So we really need to support the workers, our colleagues in mental health, to ensure that if they're, working with those ones, it's about good oral hygiene, etc., and supporting them to get to the correct services, if they're to prevent any perceived pain,
Dental phobia is a huge thing in that population, and also there is a higher craving for sugar.
Yeah.
So it tends to, a lot of people living with severe mental illness tend to have higher sugar cravings,
Which could affect the teeth.
has a direct impact on the health of your teeth. So
It's like, emotional eating.
Correct. And it's recognizing, as we said, what is good for your body and what is good for your mouth is interlinked. So having healthy habits, making sure you are giving your mouth a break, eating at regular meals, having a good routine is so important. Healthy habits come out of good routine.
We're running out of time, but I want to ask a question about exercise for our mouth. Are there exercises that we could do to keep our mouth healthy and, being able to smile much better?
So I'll go with the brushing, exercise the brushing, nice healthy mouth, but I think Shilpi's got a better one.
I think for older adults, especially, to make sure that they have got good muscle control, there are some good exercises to keep your facial muscles active and healthy, so you're able to chew and smile and have that radiant face.
So what do? I just
there is
or the vowels, or
so there is a good E-U method that gives stretches your muscles and helps build the muscle. But have a good smile. Talk to people, socialize, be happy. I think it's natural exercise. So keeping yourself physically, mentally, and emotionally happy is going to do wonders.
And also there's that nail biting and teeth grinding. Sometimes that is also indication.
So you mentioned mental health in patients, like some of them, the grinding is a factor, like they complain about their, grinding quite a bit. And it's the erosion, the enamel erosion that occurs from that grinding. So maybe,
it is. There are, as you were asking earlier about different dental diseases, and we have only touched on cavities and gum disease, but a lot of tooth wear is very common. People who brush incorrectly get sensitivity because they are not brushing correctly. People under stress tend to grind more, their teeth become shorter and shorter. So that's attrition. And then if you have either gastric reflux, or if you tend to drink a lot of acidic food, then you tend to weaken your teeth. They become thinner. So all those are also factors that impact your oral health. And suddenly you notice that you had really good white smile one day and your teeth are starting to become yellow within some years. And that's because you're losing the top coating, which is the white coating of the enamel coating, and you are getting more and more sensitive yellow teeth.
Look, we've run out of time, and we can talk more and more over this, but thank you so much for joining us, and thank you for the audience online who have asked all these questions. But any last words from you, Dr. Angela, for the media online and also for the community and health workers?
So prevention. And I think a very simple habit or routine that we can get happening going forward is brush your teeth before bed and don't rinse, so that the fluoride as you sleep, the saliva flow, decreases. You've got that fluoride healing happening there with a nice clean mouth.
Thank you.
For me, I think oral health and systemic health are so interconnected. So by keeping your mouth healthy, you're also keeping your body healthy. And so make sure that you look after yourself and have a great smile.
And with that, we end with a smile. Thank you so much, Dr. Angela and Dr. Shilpi. And thank you for joining us today and finding out about the exercises we can do to keep our healthy smile and our teeth and oral health in up to date and going for checkups. But we will be back in the next fortnight for another session of healthy information and resources to provide for you. If you have any topics that you'd like us to discuss, please let us know and send us an email. But the recording of the session will be available. Please share it with your networks and with your communities, with your family, so that they know what to do in terms of taking care of their oral health. I'm Jesusa Helaratne with Dr. Angela and Dr. Shilpi today, and we look forward to seeing you again next time. Don't forget to brush your teeth at night and in the morning too. Take care.